Hi, everyone. Welcome. So glad to have you here with us again today. My name's Leslyn Keith. I'm with Lipedema Simplified, the Lipedema Project, and we get together every Fridays. And we're together with, today I'm with Siobhan Huggins, who is also with us today from Lipedema Project as a research specialist, and today also serving as the tech specialist. Thank you, Siobhan.
All that training in my past.
And so
we,
I know. And we're so grateful to it because it's beyond me. But we get together every Friday just to talk to people about what's new and coming up with lipedema. And we do have a bunch of things to share with you, but we always love it when if you're here live watching us, post something. Of course, just say hi and tell us how you're doing. But also, if you have a comment or question about lipedema or something that Siobhan and I are discussing, definitely post that in there because we'll respond to you as much as we're able to. And there's Kathleen already from Sheboygan Falls in Wisconsin. Thank you for posting. So we just like to know there's other people here listening in. We're not just here chatting with ourselves, but Siobhan and I will just nerd out anyhow, whether or not there's anyone listening. So Siobhan, what should we tell people about today? What do we have on the list?
Well, the first thing that's coming up is a free webinar that's going to be on Sunday. And let me
and it's about surgery, right? Lipedema surgery?
Yes. And I'm going to pull it up so I can actually say the title correctly. The title of the webinar is Lipedema Surgery Right for Me? Am I Right for Lipedema Surgery? And that is going to be hosted by Catherine Seo and Michelle Jacqua. So this is a pretty important question because I know we hear a lot about surgery in the lipedema community, but the truth is that it's not right for everybody. Some people have comorbidities. We're going into a surgery like that, maybe a higher risk. And there are other people where when you ask the question of, is surgery going to improve my quality of life? The answer is actually, well, no, not really. But we need to understand what questions to ask, what things to consider, what goes into that pretty big and important decision so that we can feel really confident when we make whatever choice we make that it's the right one for us at that time. And that can always change down the road as well.
Mm-hmm. Yeah. So as you say, a pretty important webinar, and it is something that you do not have to pay for, but you do need to register. Mm-hmm. And as long as you're registered, you can get the replay, even if you're not available on Sunday, September 15 at 3 p.m. Eastern. You can still watch it later. So please register. Michelle Jacqua is a nurse navigator. She helps coordinate things and make sure everything's coordinated for you. This is the type of thing for whenever you have a maybe a complex medical condition or something like that, and there's lots of different specialists you need to see. You need to make sure that they're all talking to each other. You need to make sure that everybody is on the same page and they're communicating so that you have the best outcome possible. And that's kind of how it is with lipedema surgery. So someone like Michelle is pretty important. And Catherine is coming at this she has experience from having surgeries. So they're going to be talking with you on Sunday, and be sure and join into that.
Mm-hmm.
So there will have the links below for you to be able to register. And so I think you'll find that very valuable. And incidentally, at our 3-day virtual event that's coming up at the end of September, we are going to be talking about surgery also at that event. There will be a couple of surgeons there, as well as people who've had lipedema surgeries. So that's going to be a nice part of the event, along with everything that we do for the holistic approach. So join us for September 27, 28, 29, and register soon, because that early bird discount of only $147 is going to go away soon. Make sure you register now so you can get in on that price.
Yeah. What are you looking forward to at the event, Leslyn?
Well, what I really enjoy at these events is not only like the cutting edge, most up-to-date information, but also just the interaction between the people. And this is everybody who's there. It's this other speakers, the people who are attending that may have lipedema themselves, or it might be family members of people who have lipedema. And it's the vendors that have products that are of help to people with lipedema and lymphedema. So it's everybody there kind of at the table together. And the ability to get into small groups and have discussions in the small groups, I think it adds another dimension. It's not just sitting and listening to people talk and hopefully being able to post a question and maybe get it answered. You're able to talk to other attendees, everybody.
Yeah, and one thing that I always enjoy is seeing the transformation of the attendees over the course of the conference. So people often come in, maybe they're new and not sure what to expect, or they're veterans and looking forward to what's coming up. But then by the end, there's always a lot of gratitude and hope and even excitement in some cases, because they're like, all right, I know what to do now. I know what I'm going to work on. And that's what I like to see in people in relation to health, because oftentimes, like, it's so easy to either get lost in the weeds and not sure where to focus on, or just feel like there isn't any hope. And with lipedema, that is definitely not the case. There's tons of hope to be had. There's plenty of different things that we can do, and easy places to start is the big thing as well, where it doesn't have to be this big grand change that you make. It could be one tiny little thing that cascades into something bigger. And a year from now, you may be surprised where you're at, and we'll be there for you at that point too. So it's always exciting.
And we do design the event to be a progression, so that you, if you get there on Friday and you're able to be there at least for a lot of it happening throughout the weekend, it walks you through that, so that, I mean, if you just came on Sunday, you might be a little bit lost. But if you have the foundation of Friday and Saturday, it's very, very helpful. And like you say, you might come really not understanding much on Friday, but by Sunday, you feel like you really have a solid understanding of what's going on, and maybe your first steps, a direction you want to go.
Yeah, definitely.
And thank you to Kim in Australia. I'm hoping it's not some very bad time in the middle of the night for you. And Tamala has also posted that she's here. So thank you for being here. And Patsy, hello.
Hello back. Yeah, so Leslyn, you had brought up something to me that I think is really interesting, and that I think people should know about this week. So what is going on in the lipedema world?
Well, since we're talking about what's new and coming up, one thing that happened is just, I do believe it was last week, that there was presentations made at the CDC regarding the ICD-10 codes. And these are diagnosis codes for any kind of condition. If you want to be covered in your healthcare in the United States, your disease has to have a code. And lipedema doesn't have a code in the United States. Typically what I've had to do is, if the person also has a code of some kind of edema, they have a condition of lymphedema or some other edema, I've coded it that so that I can treat their lipedema. Those are the kind of games you've had to play. But they, Dr. Karen Herbst and others presented at the CDC and said that they're making a case for adding a code for lipedema and to be added the current schedule, which is the ICD-10, to do it now, not wait for the next schedule to come out, which is the ICD-11. So we're hoping that this will be successful. We do have an email address for you to send your comments and say, please adopt this code as soon as it's feasible. Don't wait for the new schedules to come out. And so we're posting that below. it is some mishmash of letters and numbers at the cdc.gov is where you can send your comments. And so please do that when you're able to. This will really help for people who need to they can't afford to just pay for their care themselves. They need their insurance to pay for it, and they can't get it paid for unless they have this code. So it's going to really help a lot of people.
Yeah, and I want to highlight something that you mentioned, because I've seen this question asked before of, I went into my doctor, they agreed I have lipedema, and then in my chart, I see that I have lymphedema listed, even though I don't have lymphedema, and they assume that it's a mistake on the part of the doctor, and what might actually be happening is related to this. So the only way that the doctor is able to get things like referrals covered for all sorts of things, physical therapy and stuff like that, is to have a diagnosis in the chart. And so they may have picked one that they knew is going to coincide with this, even if it's not quite accurate, because otherwise there'd be whole tons of trouble. You'd have to pay out of pocket, all of this stuff. So this will make that process easier, because if there's an ICD-10 or ICD-11 code that says lipedema, the doctor can take that diagnosis, if they feel confident with it, give it to you, and then it opens a lot of doors that are currently closed to a lot of people. So hopefully this can pass through as soon as possible. And
I know that what you're describing happens. I'm hoping that also the doctor would put in the chart that they believe this patient has lipedema, and maybe they're saying they also have a comorbidity of lymphedema. But sometimes when they say lymphedema in the chart, it is a mistake.
Yeah, sometimes
people like Tamala says that doctors don't recognize it, and so that could be that case also. So what I know that one thing that Gail Straker was always pushing for is make sure it's lipedema is in your chart, even if you have to have other things in there too. Make sure that the word lipedema is in your chart if your healthcare provider is on board and thinks that that's a diagnosis of yours. Try to get it in. She was trying to get it in their dentist chart. Get it everywhere.
Yeah, everywhere you can. So let's see. Kim responded and said it's currently 6:30 a.m., so that's not too bad.
Okay, not bad.
And then, yeah, we've got Mai from Egypt, which is pretty cool. And then I don't know. And then we have a question from Anna, who said, the other day, you, Leslyn, mentioned finding out if compression is right for you. What are the problems that people might encounter, and what are the alternatives? I got pulmonary emboli from compression. So what are some common problems with compression? And if compression isn't right for somebody, what are some alternatives that people can opt for?
Yeah, and when we say if that compression isn't right, a lot of times that means like a stocking or a sleeve. For whatever reason, you can't get it on, or it's not properly fitting, or maybe it's not the right material, and so it's sinking into crevices and bulges and stuff like that, and really could cause problems as far as skin integrity and pain and stuff like that. So I think one of the first things is to see a certified lymphedema therapist or a compression garment fitter who's really cognizant of this. Now that we can physically go in person and see people, having an in-person visit with one of these experts is really going to help, because they're going to be able to see you and measure you and know, okay, for this person, I'm going to need this type of material. I need a certain amount of stiffness, or maybe I want some textured fabric because that's going to feel good on them. Or maybe I need an alternative, as was brought up. Maybe I need to use like a Velcro product that's easier to get on, and maybe it will be stiffer and will give better containment, and it can be adjusted frequently to allow for more comfort. So there is now a whole lot of different alternatives out there, and things that are made pretty inexpensively and maybe not super high quality, that you'd have to replace often, and all the way up to very customized, quite costly things. Now with the passage of the Lipedema Treatment Act, this can be covered. I've had patients that have kept the same garment for 10 years because, they just can't afford it. And we're not able to replace them as often as they would like. But now with the Lipedema Treatment Act, and this was specifically talking about all of the products, the devices, and especially the garments, but sometimes also the bandages. So all these physical products that we use in caring for lipedema, this is covered. And so you need to go to someone who understands how to get that covered by your insurance. Quite often a certified lipedema therapist is aware of it, but maybe he or she doesn't actually provide you the product because they can't bill your insurance for you, but they would know who you should go see to make sure and maybe it would be even the lymphedema therapist will measure you and say, I want you to have exactly this product. And then you take that information over to the company that can actually get your insurance to pay for it. But start with your certified lymphedema therapist in your local community and see where you need to go to next. Because this is things that it's very individual. Let's figure out what is going to be exactly right for you. I just was talking to Phyllis Keith at Where Ease, and she had the 4 C's. Let me see if I can remember what they are. Comfort, compression, containment, and compliance.
Comfort, containment, compression, compliance.
Yes.
Very nice.
Yes. And if you're not going to have compliance, if the other 3 aren't met, right? If you're not getting the proper level of compression, if you're not getting the right containment, if you're still bulging out of it, why would you comply with it? And if it's not comfortable, of course you're not going to wear it. So, so you need someone who's going to be able to achieve that for you, to help you. And sometimes it's trial and error. Sometimes you go through a couple of different things. Well, that didn't work until you finally arrive at the one that's right for you.
Yeah. And May said, I had gastric sleeve surgery. I lost a lot of weight from all of my body except for my legs. And that is not uncommon with lipedema. There's actually some case studies talking about that where people were only diagnosed with lipedema after they had bariatric surgery of some sort because they lost from their torso and their face and their neck, but their lower body didn't have as much response, if any. So you are not alone in that experience for sure. And it's why it's so important for people, including doctors, to recognize lipedema, whether there's that frank disproportion or not. So whether the obvious disproportion is present, or maybe they have lipedema and abdominal obesity where that disproportion is hidden, there are still signs that people can look for to help tell if there's both of those going on, or maybe just one of them, or something else entirely. We can look for cuffing if we suspect the tissue is all the way down to the ankles or the wrists. We can do palpation of areas where we suspect there's lipedema tissue. We can check for signs of swelling. You can check out our case definition paper, which I probably don't have a link to handy, but I can grab one. Leslyn, why don't you talk about something interesting while I get that?
Well, and I'll talk about, our case definition paper is really, it describes and how to test to see if someone has lipedema, and to make sure that when we're doing research, we actually have people who have lipedema in the test group. But this can be used as a guide also for physicians to make a diagnosis. And what we've done also, I don't know if you have a link for this or not, Siobhan, but we've made a little 1-page document that can be used with your physician and yourself to help with diagnosis, because it kind of distills everything that's in our paper in that short 1-page handout. A lot of people are a little bit intimidated by, a 20-page paper that is, so this kind of distills all the information very easily for you, very, very accessible. And so coming up with that diagnosis again, and then hopefully being able to apply a code to it. But once we have that diagnosis, then the doors are open to you for getting the proper treatment and stuff like that. Maybe one of those treatment options might be surgery too. So, but unfortunately, because you can have obesity and lipedema at the same time, that the two disguise each other. And so it's makes it harder to, much less obvious about that the person might also have lipedema. This handout can help, because it's such a common problem. This handout can help you be able to tease that out. So I'm sorry, May, that you had that experience that that with the gastric sleeve surgery. As Siobhan said, that's not an uncommon situation.
Yeah, and I can't find the handout at the moment, but if people, whoops, oh, actually that is what I was looking for. I clicked on the right thing by accident. But if you email Leslyn, she can send you a link to the roadmap since I can't find it offhand. And we can get that over to you. It's just one pager, both sides. One is aimed at the clinician and then the other is aimed at the patient, but they actually are both helpful for both sides. So having the patient language can help the doctor recognize if someone comes in and they start mentioning these things, it's like, oh, I have something just for this.
Yes. Yeah. So email me at leslyn@lipedemaproject.org and I will get that to you. Hello, Eileen. Thanks for being here. And we have Truth Seeker. So it's saying that this person has been paying $120 for compression, $75 on sale. Well, now it's going to be covered. And so, because of the Lipedema Treatment Act. So see your provider and see if you can do that. Thank you all for posting here. We love it when you are interacting with us and with your own comments and questions.
Yeah, so, and unless anybody has any other questions, I think we've covered some pretty interesting stuff today.
And it was a lot. I mean, that free webinar, our conference coming up, the ICD-10 codes, it's a lot of stuff going on, and stay with us because we will keep you up to date on what's new and coming up with lipedema. There's always, this is an exciting time. There's always a lot happening. Thank you so much, everybody, for being here with us today. We look forward to being with you again next Friday at the same time.
Yeah. See you, everybody.
Bye-bye.
Thanks for stopping by.